evening and welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Authority and the health insurance ecosystem at large. In the year 2005, the federal government of Nigeria formalized steps to give Nigerians health insurance through the establishment of the National Health Insurance Scheme. The scheme, however, suffered setbacks and was unable to fulfill its mandate beyond covering civil servants in the formal sector. 1st of July 2019, Professor Mohammed Nasir Sambo was appointed to head the operations of the then NHIS and reposition it to drive Nigeria towards the attainment of universal health coverage. 3 years after, it is safe to say that major successes have been achieved in giving health insurance a clear-cut direction. What are some of these achievements? That is what we shall be looking at in this episode of the program as we look at 3 years in office of Professor Mohammed Nasir Sambo. I am Aisha Muhammad Ahmed, your regular anchor. Please don't go away.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, House Committee on Healthcare Services pays oversight visit to the National Health Insurance Authority. Details of these and more coming up shortly.
Attention, because if 5 people look.
The House Committee on Healthcare Services on Tuesday, the 23rd August 2022, paid an oversight visit to the National Health Insurance Authority. The team was led by the chairman of the committee, Dr. Tanko Sununu, and was received by Professor Nasir Sambo and other management staff. Honorable Sununu said the visit became necessary in order to discuss the agency's compliance to funds allocated and its appropriations alongside its successes and challenges. He also commented on the signing of the new NHIA Act into law, as this will help the attainment of universal health coverage.
To be here with you and also congratulate Nigerians, not the authority, to congratulate Nigerians, because what was done in the amending of National Health Insurance Scheme Act is to address what will go down to Nigerians as a major dividends of democracy. They have the feeling that if well executed, the provisions in the Act is enough to lead Nigeria to achieving universal health coverage.
While responding, Professor Nasir Mohammed Sambo appreciated the team for the visit. He said the health insurance system is the most progressive way of financing healthcare through the element of expenditure tracking. He took the team through the evolution of the NHIA.
The National Health Insurance Authority was created to, among other things, ensure easy financial access to healthcare. Because globally it has been acknowledged that financing healthcare is a major thorn in the flesh of delivery of healthcare services. So over time, the healthcare financing system was developed, and within it, a social health insurance system became an integral part of financing of healthcare. And when experts in healthcare financing tried to analyze the various sources of financing healthcare, both the private, public, and quasi-public, it was recognized that health insurance system is the most progressive healthcare financing system because it has ingredient of all the healthcare financing functions, which has to do with resource mobilization, resource pooling, and expenditure tracking.
In a related development, the National Health Insurance Authority has received the CEO, National Data Protection Board, NDPB, and his team in its office in Abuja. Speaking at the occasion, CEO of NDPB, Mr. Vincent Olatunji, said the visit was to inform the authority of its existence. He explained that exchange of data is in high demand now because of the global digital economy. He said the health sector deals with sensitive data that needs to be protected to enable it carry out its mandate effectively.
I do almost all my transactions on my phone here, and I'm sure with your sector, which is even more peculiar, a lot of the activities are being done online. Before we came, my prof was even telling me that you now have a data center, which I think is a very big achievement for your organization. To this extent, you understand the import of data and what you can do with data and the dangers associated with the collection, processing, storage, and sharing of data. And the health sector is even more peculiar because the health sector data is regarded as sensitive information or sensitive data when you collect them as data. Others like the PI, personally available information, yes, you need to secure them. But for the health sector, you need to put in place additional layer of security for this, for you to be able to guarantee that what you have in your custody is guaranteed and to be able to earn the trust and confidence of your data subject.
While responding, Professor Nasir Mohammed Sambo, DG NHIS, said the visit was timely, especially as the authority is making moves to digitalize its operations. He further said working with evidence is a core element of the rebranding agenda of the NHIS, and the agency has a framework for data collection that influences decision-making. He further pledged his support to the National Data Protection Body while stressing that both agencies can collaborate and work together.
I think you are home and dry in the National Health Insurance Authority. All we need to do is not to do a long story, is to have maybe a committee that can maybe sign a memorandum of understanding and come up with a clearly defined, framework for collaboration. We have collaborated with so many agencies, and we are always open to invite them into what we are doing, and they invite us into what they are doing. So, since we are from the side of protection, we will not hesitate to have this memorandum of understanding.
Welcome back. The program is Easy Access to Healthcare for All. The NHIS recorded remarkable landmarks in line with its mandates since the assumption of the present leadership of the authority. In this episode, we bring you a review of some of this milestone achievement under Professor Mohammed Nasir Sambo as he recently completed 3 years in office. First, as Executive Secretary of the NHIS and now as Director General of the NHIS. Please stay tuned.
The year 2019 is marked as the beginning of a transformational year for the NHIS, then NHIS. It began with the appointment of a new Executive Secretary, Professor Nasir Mohammed Sambo, who resumed with a 3-point agenda. The 3-point rebranding agenda include restoring a value system that will transform the NHIS into a credible and result-oriented organization, engendering transparency and accountability in the entire operations of the authority, and accelerating the drive towards the attainment of universal health coverage. In line with these, the NHIS has recorded milestones, both in its operations and implementation of health insurance in Nigeria. It began with the launch of the Gift Ship program in 2020. The year 2021 saw the new flagship program of the NHIS gaining acceptance. Some associations that have signed Memorandum of Understandings to procure health insurance for their members include the Nigerian Bar Association, NBA, the All Farmers Association of Nigeria, alongside several communities across the country as covered by philanthropists or lawmakers. Still on expanding access to healthcare, the National Youth Service Corps also signed a Memorandum of Understanding for a health insurance product, or NHIS, and its implementation is in full force already.
We come to appreciate you for the effort and the commitment for the successful takeoff of enrollment of core members in National Health Insurance Scheme.
And when you talk about gift shippers, we have gift ship in 4 variants of gift ships. So we have the gift ship, what we call the general, whereby people make contribution. We have the gift ship retirees. That we have about 40-something thousand retirees under that gift ship, especially the police retirees. We have police retirees, the DSS retirees, they are under that. We have the gift ship, the one we say for the NYSC. That what we have in our register is close to 500,000 under that. And then you have the constituency project, where the honorable members of the National Assembly use it to carry out their constituency projects.
In a bid to address complaints by enrollees about drugs administration under the National Health Insurance Program, Professor Nasir Mohammed Sambo brokered partnership to improve drugs administration and supply. To this end, MOUs have been drawn up and signed with various companies of repute, including Roche. Implementation of this new drugs administration has taken off in 7 pilot hospitals across 6 geopolitical zones, including the FCT.
The Roche, which is a very well-known pharmaceutical company, did not even wait to come into collaboration with the National Insurance Scheme to say that they want to quickly start manufacturing drugs for cancer. And they are ready to give about 50%, 30%, 50% subsidy for the National Health Insurance Scheme.
The partnership with Roche is of particular importance, especially as it relates to NHIS beneficiaries having access to quality cancer drugs.
The essence of the MOU is to partner with the NHIS. And the first thing is to bring qualitative medications through a reimbursement model to make it available for cancer patients in Nigeria. And they are top-notch medications that are used all over the world, biologic medications, to make it accessible to Nigerian patients who have enrolled with the NHIS.
In 2021, the NHIS held an engagement with drug management agencies towards refining its medicine supply policy aimed at creating drug security for NHIS enrollees. This policy will make medicines affordable as well as available for Nigerians when they visit the hospitals under what is now known as the NHIS Medicine Supply Initiative.
The challenges are various. People are going to the hospitals, they are not getting the drugs. If they get the drugs, they have the perception that the drugs are either fake or substandard. And so the cost of the drug is another issue. There is skyrocketing cost of drugs, prices of drugs, and this is mainly because of the inflation, the inflationary trend in the country.
The automation of NHIS operations is one area the scheme has achieved tremendous success under Professor Mohammed Nasir Sambo. Its interoperability will stabilize and hasten.
If I have to go to Garki and tomorrow I find myself in my village, there should be a medical history that they can build upon if we are interconnected. So it enables different information technology systems to communicate and exchange usable data. This allows providers to have access to all data for a patient being treated. And this helps a lot. It fast-track treatment. It fast-track understanding of the medical situation of your patient.
In pursuing his 3-point agenda, Professor Mohammed Nasir Sambo has continued to pursue quality assurance as top priority. Healthcare providers and chief medical directors of medical centers and teaching hospitals in a stakeholders engagement were enlightened on the new reforms going on in the authority.
It's imperative that we bring all the stakeholders, all key stakeholders, to have a very close engagement with them so that they can appreciate what is the content and the context, and probably the process that we will follow in the implementation of this very law. Because this law is so overarching that NHIS is not the only responsible body to ensure its implementation. The health insurance ecosystem is a very large ecosystem with multiple stakeholders and multiple connections. Therefore, it is important that all of us should come together, go through the content of the bill, appreciate it, then collectively design a mechanism that will ensure successful implementation.
Still on quality assurance, while refining its processes and procedures, the NHIS, under the current leadership, recruited medical personnel for all its state offices and the FCT to help it deliver effectively on its mandate. The effect of this move cannot be underestimated, as it has brought decentralization of the NHIS operations to states.
With the coming of the medical professionals in the system at the state level, and of course some few additions to that came to the headquarters because of some availability, we have seen the integrity, we have seen the outcome, and we have seen the better response in terms of the partners that we have been dealing with in terms of the health facilities, healthcare facilities, and then the health maintenance organization. They know now NHIS is different from what it was before in terms of knowledge, in terms of capacity, and in terms of those that know what they are expecting to look in terms of the relationships that we are having with those stakeholders that have been part of the ecosystem of the health insurance.
A significant milestone for the NHIS is the signing of the NHIS Act by President Muhammadu Buhari on the 19th of May 2022. This has made health insurance mandatory in Nigeria. This move has put the authority on the trajectory of attaining universal health coverage.
The law will now be mandatory for every Nigerian and any legal resident in Nigeria. And within the law, in order for government to fulfill its own side of the bargain, a provision has been made for what is called voluntary, vulnerable group fund, which will, in which so many sources of funding has been outlined, and that will bring about huge resources that will be able to cover about 83 million downtrodden Nigeria, all in an attempt to attainment of universal health coverage.
There have been retreats, stakeholders' engagement, and staff trainings. The NHIS also made its presence felt and its voice heard in various health meetings across the country. Many will agree that the NHIS has never had it so good, and its determination to attain its objectives have never been more visible. Little wonder then that the NHIS boss backed a special recognition by the Healthcare Providers Association with the Semper Fidelis Award, which is the highest award ever awarded to an individual in Nigeria.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. Today, we bring you an interview with Dr. Fabong Jemcheng, Director General, Plateau State Healthcare Contributory Management Agency. He says the new act is timely and will strengthen health insurance in Nigeria.
It's a welcome development for the people of Nigeria and for us in the health insurance ecosystem, because the law, as it were, was long overweighted and is long overdue. So with the assent of the president to the law, it makes it a lot easier for us to achieve universal health coverage in Nigeria now.
He explains further on the implication of the Act on state health insurance agencies and the NHIS.
Formally, the act in place did not make it mandatory for Nigerians to participate in the scheme. And then we have quite a number of state social health insurance agencies whose law made it mandatory. But at that level, we do not have a law up there that regulates the activities of health insurance in the country. Now, with the outcome of the new law, it makes it mandatory for every legal resident in this country. And it makes our job seamless, because at that level, we now have a law that is seamless from the national to the subnational level.
Having in mind that the NHIS Act makes health insurance mandatory, he explains how this mandate can be achieved and attained.
It can be achieved because in the new act, there is a provision for the vulnerable fund. And we understand that we have over 80 million Nigerians who are in that category. So if we have taxes from seen commodities and then the increment or the increase in the funding of the basic healthcare provision fund, it now takes care of the burden of those people who have been described as the poorest of the poor. And leveraging on the formal sector, which for us is a low-hanging fruit, it only serves as a better template to launch into the informal sector. So the law, as it were, that makes NHIS an enforcer as well, gives the right trajectory or the right template for NHIS to properly enforce the compulsory aspect of it. Formally, NHIS can only regulate, but they cannot enforce. But the law presently has given a provision for NHIS to also enforce that part of the law.
That was Dr. Fabong Jemchang, DG Plateau State Healthcare Contributory Management Agency, sharing his thoughts on the recently signed NHIS Act. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: does this NHIS have an avenue for complaint?
There are avenues for complaints. We have our call centers, we have our state offices, and we also have some of our major program departments that look after complaints like enforcement, standards and quality assurance, and formal sector.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this program today. Join us again same time and on this same station for another interesting episode as we continue to bring you more stories of happenings around the NHIS. Enjoy the rest of the evening.